Hello, we're back, and in this video lecture, we're going to be talking about coding diseases and conditions of the skin. Okay, all these codes begin with the letter L, L00 through L99. And these include the infections that are in the first section, code 00 through 08. Bullous disorders, L20 through 30, dermatitis and eczema, and all different types of things. And then finally, towards the end of the chapter, as expected, we'll have intraoperative and post-procedural complications. And then the last section in L80 through 99 is other disorders. There are a lot of excludes two notes that identify conditions in other chapters, and then some notes that say use additional codes B95 through B97 to identify any infectious agents. For coding purposes, the terms dermatitis and eczema are used interchangeably. If we have skin conditions that are caused by drugs or other contacts, like contact dermatitis, there are specific guidelines for this. And these fall into, in effect, code categories L23, L24, L25.1, L27.0, L27.1. And these are conditions that are caused by other diseases as coded in diseases classified elsewhere. So please follow the instructions in the tabular to direct you to the correct code. There are chapter-specific guidelines for this chapter covering specifically the stage ulcers. Stage ulcers are a big area of interest for CMS with present on admission, so I want to make sure that we get these correct. With this guideline, we're told to assign as many codes from category L89 as needed to identify all pressure ulcers that the patient has, if applicable. Sometimes we can't stage the pressure ulcer because it's covered, it has a graft on it, or what have you. And there's specific guidelines on how to do that. And the stage is guided by the clinical documentation. And if there is no documentation of the stage, the provider should be queried. And this is a training opportunity for providers. And we'll get into what kind of providers can document the stages. There's specific guidelines talk about pressure ulcers that are documented as healing versus healed. Healing and healed are not the same thing. And if the documentation is unclear, as it sometimes is, we need to query the physician and ask about whether this is a current new pressure ulcer or if it's healing or what. If a pressure ulcer is evolving into another stage during admission, two separate codes are needed, one for the site and stage when the patient is admitted, and one for the ulcer site and the highest stage during the patient's admission. Sometimes we have induced deep tissue damage, and then we would only assign the appropriate code for the pressure-induced deep tissue damage, the L89.XX6 code. If a patient's admitted with non-pressured ulcers and they're documented as healed and they're not present on admission, we don't code them. It goes back to the general coding guidelines of what we code. And again, please pay special attention to this guideline that's in the text in the beginning of chapter 12 about non-pressure chronic ulcers documented as healing. sometimes you can have things below the skin getting into abscesses, cellulitis, right? And these fall into code categories L2 through LO3. And different types of cellulitis and abscesses, so important to read past the main term of cellulitis. What happens here is we have some sort of injury or insult to the skin, we get bacteria involved, and then it's growing below the skin and resulting in this inflammation below the skin called cellulitis or abscesses. With lymphangitis, we're talking about inflammation of the lymph vessels that are near the skin. Strep is usually the common culprit. And then what happens is the lymph channels and sometimes lymph nodes can be infected and inflamed. And again, we talked about how dermatitis and eczema are used interchangeably. The diagnosis is made on the appearance of the skin and through a medical history and a complete exam. And there are different codes that break down the type and the severity and what's caused the eczema or dermatitis. You can see some of these here. Atopic dermatitis, seborrheic dermatitis, diaper dermatitis, irritant contact, and so on. Important to keep reading for the terms surrounding dermatitis. Urticaria and erythema is basically this kind of vascular reaction, commonly referred to as hives. And the redness of the skin is erythema, right? Due to capillary dilation, could be due to allergies, sensitivity, what have you. We also have the Stevens-Jones syndrome. Again, going back to what we said in an earlier chapter, an eponym or something named for somebody is always a good main term. Otherwise, syndrome is always a good bet. Toxic epidural necrolysis, the 10, is when large areas of skin becomes red and starts to die off and peel off, almost like a burn. And sometimes this is caused by medication. If that's the case, we'd use an additional code to show an adverse effect of a drug. Sometimes we get the radiation-related disorders, the L55 through L59, caused by sunburn. L55 is a common category for sunburn. It's not coded like other burns that we see in Chapter 19. We also have the skin conditions due to ultraviolet light, the L56, L57. Let's take a quick look at those. And you can see some of these here. And again, the important note, use additional code to identify the source of the radiation. All these things that we see talked about when you look at derm notes or go to the dermatologist, follow right here. Okay, we're back. Sorry about that. And we also have nail disorders, the L60 through L75, ingrown nails, fungus nails, nail dystrophy, alopecia, the hair loss, all these things. And again, the important thing here is to read the documentation. Last thing I'd like to cover in this video lecture is the pressure ulcers, the decubitus ulcers. Again, big thing that CMS has an interest in because patients being admitted to the hospital from nursing homes. The code should identify the site, the laterality, and the stage of the pressure ulcer. We're also directing the tabular to code any first associated gangrene. The fourth character of the code, after the L89, will identify the site. The fifth character, the left or right side, if applicable, and then the sixth character will be the stage. I hope you found that useful. Please stop by the office or see me on Zoom, I should say, if you have any questions about this material. We'll see you online. Bye now.